Medical nanotechnology, revolutionizing medicine. Welcome to the world of medical nanotechnology, an innovative and exciting field that holds tremendous promise for revolutionizing healthcare. In this comprehensive lecture series, we will delve into the various aspects of medical nanotechnology, exploring its fundamentals, clinical applications, challenges, and the ethical considerations surrounding its implementation. To lay a solid foundation for our understanding, let's start by exploring the fundamentals of nanotechnology. Nanotechnology deals with manipulating matter at the nanoscale, where materials and systems possess unique properties due to their small size. We will delve into concepts such as nanoparticles, nanodevices, and nanomaterials, emphasizing their implications in medicine. Incorporating medical nanotechnology into reproductive medicine holds great potential. We will discuss how nanoparticles can be engineered to enhance fertility treatments, focusing on their interaction with reproductive anatomy and physiology. We will explore the role of nanotechnology in improving the diagnosis and treatment of infertility, contraception, and assisted reproductive technologies. One of the most significant contributions of medical nanotechnology is the development of advanced drug delivery systems. Nanoparticles can be designed to carry therapeutic agents, ensuring targeted delivery and enhanced efficacy. We will examine different types of drug delivery systems, including liposomes, nanoparticles, and nanogels, discussing their mechanisms and advantages. In this section, we will explore the fascinating world of drug encapsulation and release using nanotechnology. Researchers can encapsulate drugs within nanoparticles, protecting them from degradation and enabling controlled release. We will delve into the various encapsulation techniques, such as polymers, dendrimers, and carbon nanotubes, understanding how they influence drug release kinetics. Targeted drug delivery is a game changer in modern medicine, and nanotechnology plays a crucial role in achieving this precision. We will investigate how nanoparticles can be engineered to specifically target diseased tissues or cells, minimizing side effects and maximizing therapeutic outcomes. Various strategies, including ligand-mediated targeting and surface modifications, will be discussed in detail. To successfully deliver therapeutic agents, it is essential to overcome biological barriers that exist within the human body. Nanotechnology provides innovative approaches to bypass or navigate these barriers, such as the blood-brain barrier, mucosal barriers, and cellular barriers. We will examine the mechanisms by which nanoparticles can traverse these barriers, shedding light on their potential in treating previously untreatable conditions. Understanding how nanomedicines interact with the body is crucial for their safe and effective utilization. We will explore the pharmacokinetic and pharmacodynamic properties of nanomedicines, examining factors such as biodistribution, clearance, and elimination. The unique characteristics of nanoparticles and their impact on drug metabolism and action will be thoroughly discussed. The safety of nanomaterials and their impact on living systems are paramount considerations in medical nanotechnology. We will delve into the concept of biocompatibility, assessing how nanoparticles interact with biological systems and evaluating their potential toxicity. The importance of thorough toxicity studies and the necessity for regulatory guidelines in ensuring patient safety will be emphasized. Medical nanotechnology has already shown great potential in various clinical applications. In this section, we will explore its utilization in diagnosing and treating different diseases, including cancer, cardiovascular disorders, neurological conditions, and infectious diseases. We will highlight recent advancements and discuss their impact on patient outcomes and healthcare delivery. The rapid progress in medical nanotechnology necessitates careful consideration of its regulatory and ethical aspects. We will examine the challenges associated with the approval process, intellectual property rights, and public perception. Moreover, ethical dilemmas related to the use of nanotechnology in human enhancement, privacy concerns, and equitable access to nanomedicines will be thoroughly examined. Looking towards the future, we will discuss potential advancements and challenges in medical nanotechnology. We will explore emerging technologies, such as nanorobotics and nanosensors, and their potential impact on diagnosis, treatment, and preventive medicine. The need for interdisciplinary collaboration and continuous research will be emphasized as we strive to overcome challenges and unlock the full potential of nanomedicine. In this particular case study, we will discuss the use of nanoscale drug delivery systems for targeting reproductive organs. By leveraging the unique properties of nanoparticles, scientists have developed innovative approaches to deliver drugs specifically to the reproductive system. This has significant implications for the treatment of conditions such as endometriosis, uterine fibroids, and various types of reproductive cancers. One such example involves the use of biodegradable nanoparticles loaded with anti-cancer drugs for the treatment of ovarian cancer. These nanoparticles are designed to selectively accumulate in the tumor tissue, allowing for a higher concentration of the drug to be delivered directly to the cancer cells while minimizing systemic toxicity. This targeted drug delivery approach has shown promising results in preclinical studies, with enhanced therapeutic efficacy and reduced side effects compared to conventional chemotherapy. Another case study focuses on the treatment of male infertility using nanotechnology-based strategies. In some cases of male infertility, the delivery of therapeutic agents directly to the testes can be challenging due to the blood-testis barrier. However, nanocarriers such as liposomes and micelles can bypass this barrier, enabling the targeted delivery of drugs to the testes. This approach has the potential to enhance the effectiveness of certain treatments, such as hormone replacement therapy or antioxidant therapy, in improving sperm production and quality. Furthermore, nanotechnology has also been utilized for targeted drug delivery to the female reproductive system. For instance, nanoscale drug delivery systems have been developed to address common gynecological conditions such as vaginal infections. These systems consist of nanoparticles loaded with antimicrobial agents that can be applied locally to the vaginal mucosa. This localized drug delivery approach allows for a higher drug concentration at the infection site, resulting in improved treatment outcomes. In conclusion, these case studies highlight the successful integration of medical nanotechnology into the field of reproductive medicine. By utilizing nanoscale drug delivery systems, researchers and clinicians can enhance the effectiveness and reduce the side effects of treatments for various reproductive conditions. The future of nanomedicine in this field holds great promise for personalized and targeted therapies tailored to individual patients' needs. In conclusion, medical nanotechnology represents a groundbreaking frontier in healthcare. The integration of nanotechnology into medicine has the potential to revolutionize diagnostics, therapy, and disease prevention. However, it also necessitates careful consideration of regulatory frameworks and ethical guidelines to ensure patient safety and equitable access to these advancements. By exploring the fundamentals, clinical applications, and future perspectives of medical nanotechnology, we can better appreciate its transformative potential and work towards its responsible implementation. That concludes our detailed script on medical nanotechnology. Thank you for your attention, and I hope this lecture series inspires you to delve deeper into this fascinating field.